Welcome to this episode of your Wellness MD podcast. Family physician and wellness expert, Dr. Daniela Stein, has meaningful conversations that will take your health to the next level. She explores the connection between a healthy body, mind, and soul, and shares tips that will enable you to thrive. Dr. Stein has helped thousands of people have a better quality of life by improving their health with science-based knowledge, education, better nutrition, mindfulness, and lifestyle choices. Join us today, empowering you to live your best life with optimal health.
Hi, I'm Dr. Daniela Stein, and today I have Natalie Freiberg with me. Welcome, Natalie.
Thank you for having me. I'm very excited to be here.
Natalie is a psychotherapist, a counselor. She studied in psychology and also in social work, and she's an incredible counselor. That's why I have her here today, and I would like to share some of your knowledge with our audience. Tell me a little bit about yourself. Why did you become a counselor?
I have been helping individuals since I was so little. It is part of my DNA, truly. Going back to the younger years, I was always the assistant for the teacher, always helping out in school and community services, and it just came to me very naturally.
Oh, and we can clearly see it, the way you work with clients. It's clearly part of you, that desire to help. And that's why people are so happy when they are Natalie's clients. And then you did more training, you did a master's in social work, and now you're passionate about helping people through transitions. So tell me a little bit, what type of people do you see for counseling?
So I work with teens, young adults, and adults who are going through various life transitions, and going through various challenges that come along with that. So we'll see individuals who are struggling with grief and loss, or anxiety, depression, self-esteem issues, women's issues, and
that's a big thing. So at my wellness clinic, I see people for functional medicine and lifestyle medicine, and this is really one of our critical pillars of health. So if you come and see me for anxiety, I would say, but you have got to see Natalie for your anxiety. So I can treat a part of it, but then we are not just maybe medicine or diet, we are also the psychology part behind it. And then, so other things, like I see a lot of women for menopause. Then I'll have to say, okay, but you've got to see Natalie. I can help you with getting hormonal balance, but just adjusting to this stage in life. Or when I see people for so many different illnesses, and there is actually a medical diagnosis for it that we call it adjustment disorder. So even if you say you don't have a psychiatric illness, you didn't think you need to see a counselor, now because there's a change in your life, there is an adjustment, then people often need to see a counselor. And that really helps to really process, to work through what type of adjustment you have in life. So tell me a little bit more about adjustments. So some of the adjustments I can refer to you would be for menopause, but then what other adjustments do you see people?
Yeah, so I think, there's this stereotypes that adjustments have to be, a misconception that these adjustments have to be so grand. So really big life transitions. And really it could be for anything small or big. It doesn't change the value or how hard those changes and life adjustments can be. So, I've had clients come in for a range of different issues, for big ones like starting a new job or, becoming a parent for the first time.
That's big. And we are both parents.
Yes.
We know, oh goodness, I should have gone for counseling. Both of us have 3 little kids, and we know that is such a big transition, and quite often you're just thrown into it, and you're just treading water and figuring things out. But that is something I would recommend new parents to consider, having that counselor, having that person to talk through this, because are you sure that's the most major life change you can have?
Completely. And, you know, I really value, and, you know, two things, you know, the practice being a holistic approach, and I think that's something that you very much value yourself. And then also taking a preventative approach. So, you know, oftentimes clients will come when they're at the end of their rope, when they're really feeling stuck or hopeless. And really it is coming in before you get to that point and knowing what the signs are before you get to that point.
And that's really one of the pillars of lifestyle medicine, is to not just look at the medication part that the doctor is giving, or the lifestyle, being healthy, eating healthy, sleeping healthy, but managing your stress. How do we manage stress? And counseling is quite a critical part, and there's a lot of research that really shows that psychotherapy is so helpful, and it's helpful for more things. I do psychotherapy for more things, so let's talk about other things. Other things that it's helpful for is ADHD. So it's, our listeners might be familiar that it's helpful for depression, for anxiety. So in the life change, definitely if someone goes through a divorce, that's quite important for everyone in the family to have access to a counselor. And then grief is a big one. If we lose a loved one.
So for grief, for example, that's actually funny enough what I was going to discuss next. For grief and loss, it's not just about losing a physical person, it's the losing a chapter of your life, or ending that chapter, starting a new one. And so that can be something that's so important to process. And it really ties into, you know, your self-identity. So who am I? And questioning who am I becoming as I go through this very big or very little change in my life.
Yes, that's a big one. And I've also found when people go through something like a divorce, it's often harder, because if you lose a loved one, people often have support around them. But then when a family go through a breakup, you don't necessarily have that support, because that person is still alive. You have that loss because you had this anticipation that you would have had this loved one. You don't have this loved one anymore. So you have this loss, but I feel a lot of my patients really feel kind of very unsupported and very alone after a divorce.
Absolutely. And that really can apply to many different life adjustments or life transitions, because I think there's this notion that you're supposed to be able to get through transitions so easily. You know, when you're a little child, you know, the teachers and the, you know, wellness experts really encourage, you know, supporting your child through those adjustments, help them transition from one to another. So when it comes to, you know, we were talking about becoming a parent and how big that is, you know, when you're transitioning, you know, there are expectations that you should be able to go through that smoothly, and so that support sometimes can be lacking.
For sure. And that's why I often always refer people that come to me for menopause, really, for this type of counseling, because the menopause is such a big transition. We often have, when we go through our teenagers, we typically have the support of our parents in our house. And then when we go through menopause, we do not have that support. We sometimes seek that support in our partners. Some people do have wonderful partners, but most partners do not have years of studying at a university like you in psychology, knowing how to help us through a transition. So menopause is definitely something that really impacts your work, impacts your quality of life, and your relationships with your partner, your spouse, people at work, your children. And if we can have someone to guide us, a coach or a counselor to guide us through this transition, it can make such a tremendous difference in our quality of life.
Completely. You know, there's this misconception that, you know, when you're going through something such as menopause, you're supposed to compare yourself to someone who might be going through menopause or something similar as well. And so what happens is that you end up comparing, and you don't get the full picture. And so you end up questioning, why is this woman going through it so easy and I'm struggling so much? And that's really tricky. It leads to feelings of inadequacy or failure. And so it's really important to...
I see that in my patients all the time, and they find it very hard. They would say, oh, but my mom went through menopause with no problem. My sister went through menopause with no problem. Why am I not coping? You know, is it something... That is something that I see in physician burnout quite a lot. So all the physicians who come to me for burnout, it's quite important that if they don't see me for cognitive behavioral therapy, I make sure that I will only see you as a doctor if you see someone for that psychotherapy part. And that's usually the first thing they come with. If all the other doctors are coping, why am I not coping? And to address that first, it's not that it's a flaw in you as a person. It's rather your ability to recognize that you need this, and that's what we're really about, to improve our quality of life, improve our happiness, and psychotherapy is one of those tools to get us there.
Yes.
And all of us, all of you watching and listening today, we know you can be happier and healthier, and counseling is really one of those tools to process and to help us get to that.
Absolutely. It's an area, to really build your toolkit. So, creating those benchmarks for yourself rather than comparing to others. That's, processing through your grief, your loss, your self-identity, processing the trauma that you might have experienced.
And all of us do, right? Even all of us, there's no way going through life without any trauma. So whether it's maybe childhood trauma or school trauma or life trauma, work trauma, whatever it is, we can be so much healthier if we are able, with the help of a professional, to identify that. Tools to address us, because we're not the first people who have to work with certain trauma things. So we might as well use specific tools to help us get through that.
Absolutely. Sometimes I'll have clients come in who really struggle to get to that point of seeking support because, again, there's that misconception. I couldn't get through this on my own. I failed. Or, that means that I am not worthy. And so it's that nervousness of, why can't I just get through this with ease like everyone else?
So what are the most common myths that you see that people might prevent people from coming for counseling?
So some of the myths really include, some I touched on already around, if I seek support, I failed.
I'm not strong enough.
That's one. Or you're supposed to know what you want out of a transition or a life change, and you're not always going to know.
We don't. We don't.
If we look at the pandemic, for example, that's an unexpected life change that happened globally. And so you cannot prepare for something like that. And everyone's response through that was very different. And so knowing what you want is not always the case.
And then, so one of the things, so with counseling that's really beneficial is it helps us to build resiliency. Chat about that a bit. What do we mean with that?
Absolutely. So for building resiliency, it's a very strong word. I'm very careful when I use that word with my clients because there's this expectation of I should just be resilient, and that takes a lot of behind the scene work to really get you to that point. So for me, when I think of resiliency, I think of building an individual toolkit for every client so they can go into their toolkit and really find which coping strategies can help them move forward and build that resiliency, if that makes sense.
Yes, it does.
So for example, with certain clients, it would be, building up their toolkit of, learning how to journal.
Oh, that's a big one, journaling. I love journaling. Yes, and I teach that to a lot of people. We can actually pause there a little bit and chat more. I'd really like for people in our audience to hold on to that. If this is something that you can take away from our chat today, even if you're not ready to commit for a counselor, journaling every day. So the good things about journaling is it helps you to be more self-aware. Did I have a good day or a bad day? If today was horrible, why? Sometimes when people are too depressed to journal, I would say just write down a number. Was your number 10 out of 10 an amazing day? Or was it like a 1 out of 10 the worst day ever? And just give your day a number. And then find out at a certain point which days have higher numbers, which days have lower numbers. How, and if we can track that over time, you can see, do you have a seasonal affective component, seasonal affective disorder? Is it worse in winter? Is it your work? Is it your family? Is it a certain friend that really sucks the life out of you? So if you can be self-aware and through your journaling notice that, then you can start avoiding people that don't fill your cup and just drain you.
Totally. I think self-awareness is so important. And, journaling really helps really take a step back and reflect. Sometimes I'll have clients who will journal and they'll say, you know what? I ended up only having 2 hard days this week. They feel so strong and really take over the whole week, but that isn't really a reflection of my whole week.
You're more objectively looking at it.
Yes.
And when you have a difficult situation, I find it helpful when I'm in a difficult situation to get that objective, almost like a counselor, a third person view on the situation. It helps me to put myself in someone else's shoes, to say that this was a horrible incident that happened.
Yeah.
This is what I did. This is what the other party did. And then you can say, but this is what they are thinking. This is where they are coming from. So it really helps me to then have empathy with this person and to see the situation from that person's standpoint.
Completely. And I think that's probably one of the most healing parts about coming in for counseling is that validation that you get, that empathy that you get, especially if there is an expectation that you should be going through a challenge with more ease, to have someone tell you, you know what, this is really hard and this should be hard, it can really make a change and help create those first few steps in moving forward.
Yes.
Yeah.
And we should actually talk about that next, but that is really empathy, because that is something that I've learned is we tend to be, and I see with all my clients, but especially my perimenopausal clients who come in, would be women that's so hard on themselves because your whole life you get so conditioned to care for everyone around you.
Oh, absolutely.
So we often don't have that space to care for ourselves. Yeah. And that's what a counselor helps us with, is to develop that empathy, that self-compassion.
Yeah, when clients come in, the first thing I will do is remove the but from a sentence. So, I've been really struggling, but I'm so grateful. No, there's no but.
Yes.
It was hard. And, that empathy is really removing that from a sentence. Not just for me to remove it for them to learn to remove that for themselves. And it's very different than sympathy, right?
So talk a bit about empathy and sympathy.
Yeah, so, a friend can really sympathize with what one's going through, but empathy is different in the sense that you can really understand and put yourself in their shoes and understand what they're going through, and they feel heard from that.
That's very valuable. I often see in my wellness clinic, when I see people for lifestyle medicine, that I would tell them they need counseling, but they would be surprised because they didn't think that they needed counseling. Maybe someone comes to me with depression or anxiety or stomach ulcer or an autoimmune disease. So people always come to me for physical medical things, because I'm a medical doctor, so they see me for medical things. That when I start treating them and I look at the pillars of health and I address their sleep, their nutrition, their exercise, their stress, their relaxation, I would say you need to do counseling. And then people would sometimes be surprised. So from your perspective, because you've worked with so many clients, when do people need to go for counseling? If our listeners, if they're listening today and they think, should I go for counseling? Not. When should they come for counseling?
Yeah, and so, I spoke earlier about taking a preventative approach. I think that's something that's very important. And sometimes people will be surprised that someone suggests counseling to them, because there's this notion that, time will heal all wounds, and that you just have to, push through it. Yeah. And so there can be different signs depending on the individual. With life adjustments comes that emotional roller coaster. So if you find yourself really struggling to cope between the excitement and hope of that life change, and then the anxiety and fear that come with that life change, kind of going through that roller coaster can really be exhausting on a person. So if you find yourself really going back and forth between a lot of those emotions, to me that could be a telling sign that it could be helpful to speak to someone
Yes.
about that.
And then, so for some people, so me personally, I know I need to talk to someone when I feel like I'm treading water. If someone asks me, how are you doing? And you're doing so many things. And I'm like, no, I'm just treading water, just trying to keep my head above water. So that is my feeling when I get. Some of my patients who come to me would tell me they can't sleep or they get up 4 o'clock in the morning. Something people often find is they just lost all enjoyment in life. They're supposed to be happy. They have lovely family, kids, friends, people they should enjoy, but they're not enjoying it.
Yeah, absolutely. So really, it's that interest in life. Are you finding yourself present in your life the way that you have been in the past? And are you enjoying things in the way that you have? Sleep, appetite, all those other ones are of course telling signs as well. Another really telling sign is, what does your support look like? Do you have someone to confide in? Do you have someone that can help support you through that? That's another very telling sign.
Yes, for me. And that's a big one. I often find that we are looking for support in a child, a partner, a parent who's not really equipped to give us that support. So that's not the hard one. On the one hand, you really need that support. It's critical to get support. But on the other hand, I'm teaching people boundaries. Because quite often there's people seeking that support from us. And then when you're just giving all the time, that's quite hard on you. So that might also be a time for you to get that support, not from your partner, not from a parent, not from a child, but to get that support from a counselor who's trained to give that support.
When you're feeling stuck, you're feeling hopeless or helpless, or you're kind of going through life in autopilot. And
we see that in burnout quite often.
Totally. The signs of stress and burnout, going through life in autopilot, slowing yourself down and looking at yourself, how am I getting through my days and weeks is something to question.
So I found this advice from a business coach mentor where he told me the first thing we should start off with is counseling. And I was quite surprised by that, but to get a counselor. And then the other way, I did more training through our Physician Leadership Institute. And they also started with, they said, self-awareness. The first course we had to do before you can be a leader was to help you with that self-awareness, that self-growth. So to be a good mom, to be a good partner, to thrive through life, we really have to take that step back, become self-aware, what makes us happy, what makes us sad, what enables us, what drains us. And I find that is where a counselor is really helpful to help us through that.
Absolutely. I like to use this oxygen mask analogy. So when you're on an airplane and the oxygen masks come down, you're always instructed, put yours on first before a child's, because if you're not filling yourself with all the goodness for yourself, there's no way you can be present for your work, for your children, for a partner, and so on. And
that's a big one in hospital. When I see my patients, and even today, every morning when I do rounds, I would see the patients, and then I'll ask the people at their bedside, so how are you doing? And they're like, oh, the patient's okay. No, but how are you doing? Because so many of our patients who are so critically ill, we see them for a short period of time in hospital, but they're at home most of the time, where their caregivers have a significant burden caring for their loved ones, caring for aging parents, caring for an aging spouse, caring for someone sick, and they get significant burnout. And we treat the patient, but that's why I really make a point of that. In every patient's room that I walk in every morning, I ask their loved ones at their bedside, how are you doing? How are you coping? Do you need respite? And I always advise people, especially people whose loved ones needs 24/7 care, I always advise them, when their loved one is in hospital, take a break. See this as your little bit of respite. And they're like, no, I can't leave my partner, my spouse alone. I'm like, yes, this is your chance. Go for that. Go do your nails. Go do your hair. Go get that break, right? So that is quite important to, even if you're not going through that, if you're the caregiver, to be a good caregiver, to seek help, to seek counseling, to get some support for yourself in order to care for your high needs child, or in order to care for everyone around you.
Yeah, it's not always that you come across such a lovely physician who will, encourage that. And so, it's really important to be able to really encourage yourself in that sense, because while for you, your patients are very lucky that they get that from you.
But even when I tell the family members, they're like, no, I can't leave my loved one alone.
Yes, absolutely.
So it's something we do to ourselves.
Yes.
Absolutely. It's that empathy we spoke about earlier. Yeah. We often don't give ourselves that grace, ourselves that compassion.
Yeah, I think, when it comes to counseling, when it comes to mental health, sometimes this notion or this idea goes really into black and white thinking of, counseling is for very extreme circumstances. And so I'm not going through an extreme circumstance, so I don't need counseling. Yes. And that's not always the case, that, it's not that you have to go through something big in life to be able to get that support.
Yes. Yeah. And then so when I do work with clients, I say I refer a physician to you with burnout, or a mom that's going through menopause, or any client. You don't see them for one session and then they're done. And that's what I've always found in family practice. If I refer someone to a psychologist, they'll come back after a session and say, I'm not fixed. I'm like, no, because this is not a Band-Aid that we're just putting on. This is a journey. Yeah. So the purpose of this counseling is to grow through this journey, to equip ourselves, to become fuller, more well-rounded, more wholesome human beings.
Completely.
So that's why if someone book with you, they have to book 12 to 14 sessions. So talk to us a little bit about that, because I often find that patients are quite surprised. They thought maybe they did go through the first session, and then they learn something else in the second session, and the third and the fourth. So what are the different things that you work with?
Yeah, so for each client, I really meet them with where they are at today. And that really will differ from one to another in terms of their self-awareness, in terms of their previous coping strategies.
Oh, for sure, yeah.
And so, every session can look different. For some, it will be, helping them build their toolkit that I mentioned earlier, and learning different coping strategies in that sense, whether it's journaling or meditation. And some might say, Natalie, I'm not into that right now. And so for others, it could be starting by processing that grief and loss that they might experience, labeling their experience that they're going through. So that might take a few sessions even. In some sessions, it's really working on your self-identity, helping you, process who are you as a person
That's
today.
A big one.
Yeah.
And that's the other thing, because we change. Even if you've seen a counselor 5 years ago, 10 years ago, and you figured yourself out, no, we change.
Yeah, absolutely. And so, another one would be, helping you build your networks and support outside of counseling, and learning how to communicate with those. So that,
I found that's a big one.
Yeah.
So I see a lot of moms, whether it's a new mom or a perimenopausal mom, and for some reason we don't have that ability to talk to our partners. And sometimes people will complain, oh, you're not helping in the house, you're not helping with food, but they don't communicate the need. Let's plan for the week ahead. Who's going to shop? Who's going to cook which meal? So there's a big difference from communicating your needs, planning, being very positive, proactive, than complaining about wrongs. That's not helpful to anyone.
Absolutely. It's a space to complain and also to be proactive. Yes. Communicate, learning how to set boundaries is another very big one.
Communication and boundaries.
Yes. Yeah, and another big one is also time management. It's something that sometimes clients might be surprised that is discussed in sessions. It can be very impactful to learning how to manage your time in a way.
Empowering.
Yeah, totally.
Yes. Yeah. And that's a big one, especially if you have ADD, adult attention deficiency disorder. That is a big thing. There is so much research that really shows. So everyone who comes to me for medication, I say, yes, I'll give you medication. Some people prefer herbs or supplements. I can do that. Some prefer food and lifestyle changes. I can do that, but I'll only do it if you do it along with CBT. And CBT is a form of psychotherapy. It's cognitive behavioral therapy. And how CBT is a little bit different is we don't really focus as much on the past. We'll go through your past, and all of us have gone through some trauma, but then we put that goal setting and how are we going to reach our goals. And then we look at every session at a different tool on how we're going to reach our goals.
Yeah, and so I was going to bring that up as well around sessions where we spend really processing what are your individual thinking patterns.
Yes.
And learning to reframe some of those.
Oh, that's a very big
important.
one.
Yeah.
So for our listeners, can you give us an example? Because that is something I learned in my life, and that's had such a big impact on my life. And then I feel, that's really been a game changer for me, to recognize negative talk in my mind and to replace it with the type of talk that I would give you, our listeners or patients, and be more. Can you give examples?
Absolutely. I see this, it comes up with everyone, but an example that comes to my mind right now is Parenthood. And so, parents can be so critical of themselves. And so, they'll go through a difficult phase of parenthood, whether it's with littles or older or adult children, and they'll make what they feel like is a parenting mistake, and that will be their whole identity. I am not a good parent. And so really, evaluating and processing what are those experiences that you went to and how they aren't attached to who you are as a person, and reframing that in a different way for that individual, that this was a separate experience outside of me and this doesn't define me.
And to give yourself that grace.
Yes, absolutely. Giving yourself that grace is so important.
Oh, that's incredible.
Yeah.
Natalie, it was lovely chatting with you. I'm sure you guys really enjoyed and learned a lot, and I really hope each one of our YouTube watchers or podcast listeners really gain something from this that they can implement in their own lives, whether it's to start reflecting, journaling, or to go seek help.
Yes.
If any of you are interested in booking a session with Natalie, I'll have all her info in the description. It's a psychotherapist, Natalie Freiberg. She's phenomenal. You will be so happy if you just pick up your phone today and book with her, book a session. It might just be the game changer that you've been waiting for. And you can see clients throughout Ontario.
Yes,
right?
I can see clients throughout Ontario.
In Canada, if you live in a different place, there are very good online counseling services. For example, a lot of my US patients, I refer to BetterHelp. It's an app that you can get for a set monthly subscription. You can get a weekly counseling. They're similar in all the countries that I've worked with patients. When we just Google online counseling services, we found online counseling services in their area. So if you just look at it, and it's sometimes more affordable if you do it online. Invest in yourself, invest in your health. Thank you for your time.
Thank you. This
Natalie.
was such a pleasure. Thank you for having me.
All the best.
Thank you for listening to this episode today by medical doctor Daniela Stein. Follow us on social media and subscribe to our newsletter at www.wellnessmdhealth.com to stay up to date on educational resources that will take your quality of life to the next level. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your healthcare provider. Never disregard medical advice or delay in seeking it because of something you have heard on this podcast. Remember, you are created to thrive.